All right, let's get started. Today, our webinar is on how to use digital wound care to drive better patient outcomes with Reach Healthcare Services. We'll be having an informative one-to-one discussion about Reach's best practices and its strong wound care program with topics including improved patient outcomes through digital wound technology and improved staff productivity. If anyone has any questions they'd like answered, please feel free to submit them in the chat at any time, and we will answer a few at the end. Today, I'm joined by two incredibly intelligent people, Lily and Amy. Lily is a senior leader with Reach Healthcare Services and has over 12 years of leadership experience in operational and administrative roles with healthcare organizations. She's a graduate of the University of Texas and holds her BSN RN and CHHCM designations. Amy has over 15 years of post-acute care clinical experience and oversight of operations, staffing, and major EHR configurations in healthcare facilities and projects. She's helped transform facilities into world-class leaders in the adoption of digital health innovations such as Swift Skin and Wound. And Amy will be taking it on from here.
Great, thank you. Thank you everyone for joining today. Just a couple housekeepings. Everyone is muted at this point. Again, if you have any questions or questions, please submit them in the question box located in the Zoom meeting. With that being said, Swift Medical, we are located headquartered out of Toronto, Ontario, with teams across the North America. We specialize and focus on digital wound care management in the cross continuum, home health, hospitals, wound care centers, and skilled nursing. Some of our exclusive partnerships, Epic, Access, Point Click Care, and Healogics, where we have an integration with our digital wound care management software. Swift Medical is industry-leading technology. We monitor over 15,000 patients monthly and wound care and skin conditions. Like I said before, we have teams located in Chicago, San Francisco, Toronto, and Montreal. We've partnered with some of the largest home health or home care organizations, healthcare organizations in North America. Swift overall is a digital wound care management. We have three parts. We are a mobile application, Helix, and dashboards. We have clinically validated automatic measurements, which I'll show you later on, where essentially you're taking an image of a wound and the measurements are automatically calculated for you. We have standardized and consistent documentation, world-class documentation, holding your clinicians to the highest standard of clinical documentation related to anything skin and wound. This is available on a tablet or any smartphone and is available online and offline, because we know in not every setting or every home there's accessible Wi-Fi or cellular service. So your field staff can function on a day-to-day, hour-to-hour basis, and then as soon as they regain Wi-Fi or cell service in the background, it syncs automatically. And then on your back end in your office, there are dashboards which allow for deep dives on a patient level. So your remote viewer can look in the office while your nurse is in the field and have a comprehensive conversation. You have visibility into your entire wound care population. So whether you're drilling down to that one particular patient that you're looking at, or looking at your wound care population across your entire census, who's improving, who's deteriorating, who's healing, and who's not. As well as you can track progress and differentiate your wound care patients with referral sources, meaning that you can look at which physicians or which hospitals or agents or skilled nursing facilities are sending you different referrals, and how can you track the progress and show them that you are delivering world-class wound management. So with that being said, I'm going to jump into a quick demonstration of the Skin and Wound mobile application. I'm going to change screens here. With that being said, you should now be seeing an iPhone screen. So what happens is once you've deployed Swift Skin and Wound, your field staff have the ability to access their patient information from the mobile device. So as you admit or discharge patients into your census, it will populate here as well. So when your nurse is out in the field or that clinician's out in the field, they can just simply select the patient that they're going to work with. The information that you want to come across will show here is populated for them. So we can see that this patient, Gloria Banks has 3 skin conditions already. So we're going to take the scenario that this patient, I'm going out to visit them today, and I have identified that they have another new injury. So I'm simply going to tap the plus button, new wound, and with that, I'm going to hover over the image. So what you're seeing here is this little blue dot. This is called a helix. It's a calibrant. So it does a few different things. It calibrates for lighting, color, consistency, and size. As we all know, in the home, it's not always the best lighting. So this gives a couple different things. It gives the clinician the ability to identify when the camera's in the optimal range to take the picture. 2, it's going to help calculate the proper measurements. And 3, it's going to correct or color calibrate the image. So with that being said, I'm simply going to tap on my phone and take the image. From here, I'm simply going to trace around, loosely trace around the edge and refine. So what happens here is you'll see that the Swift Skin and Wound has automatically identified the outline or the perimeter of the wound. So as a clinician, I have the ability to overwrite or to adjust the trace as I see fit. So from here, I'm going to save it. And then assuming your agency does standardize head to toe measurements, all I'm going to do at the first image capture is set the patient's head. With this happening, every nurse after me seeing this patient will know exactly where the patient's head is in relationship to taking the picture. So from here, I'm going to enter the depth of the wound. Undermining and tunneling is a simple swipe. Again, undermining and tunneling must be done manually. We can't assume the camera can see what a human eye can't. And that little helix in the top right corner, we're going to color calibrate. So as you can see, it's a balanced preview. So this is going to give the remote viewer or who's ever looking at this on the web or on a mobile device is going to give it as if they're there in real life, seeing exactly the colors of what's going on in that wound. So we're going to save it. From here at this first image capture, it's going to prompt you through the workflow. This is going to allow for that consistency. So you set the location once. It's simply a body map that you can zoom in and zoom out. As you can see in the left lower hand corner, it's going to tell you where I've identified on the body, where this was acquired, and what is the age. With that being said, that those things are consistent data. So irregardless of the nurse coming behind me, that type at the stage, the location, the head of the body is going to be persistent data. So it allows for that consistency of documentation, and we don't want a right heel changing into a left heel or a 4 now being classified as a 3. Again, with user roles, you have the ability to update or edit that data as necessary. So what happens here is real time out in the field, your clinicians actually see what the measurements are of the image. You go through and can finish your comprehensive evaluation. So it is clinically based. It is meets all federal and regulatory guidelines. I'm just going to answer a few questions here. What you'll see happening as I'm entering, stuff is going to start answering for me. So what's going to start happening here is as I'm entering this, it's going to start calculating my push score for me. So you can see now that I've answered all those fields required for calculating a push score, that is here. As well as anything that I've started entering is accessible on the home screen. So your nurses in the field would continue that process, finishing the entire evaluation. So let's say last week I saw Gloria, and this week Lily's going out and she's seeing Gloria. So Lily already has the ability to see what I've seen in that prior week. So Lily can reevaluate this wound. And so what we can see here is it's already indicating where the patient's head is, as well as I can see almost through Lily's eyes what she saw last week seeing that patient. So here I'm simply again going to hover over the wound. My helix is turned orange, telling me it's optimal to take the image. I'm simply going to trace again, refine. Again, I agree with it and I'm going to save. My head to toe has already set because we've set that. And from here, I'm going to save. And I've skipped a few things for undermining tunneling in depth because I want you to see that in real time, your clinicians out in the field have the ability to identify immediately, has this wound increased in size, has this wound decreased in size, and act appropriately while out in the field. From here, the other piece that is a timeline view. So what happens is you end up start seeing consistent documentation week over week where you have a timelined or lapsed view to see the patient. And as I pull up Miss Patricia here, what your clinicians actually can see is this time-lapse view of what's going on. So your clinicians can actually stop at any point and pull up this drawer and actually see what's been going on historically, what the changes are in real time with this wound as well. With that being said, I'm going to switch over to the dashboards. So your back office staff in real time have the ability to see what's going on. So your back office staff can see exactly what's going on. So Miss Gloria Banks, I was just out in the field and I took an image of her. I can actually see in real time what's going on with her. I can look at these images that I just took. So if I'm out in the field and I need help, I can call Lily and say, can you look at patient X, Y, and Z and give me some information of what's going on in them in real time. You have the ability to look at the image without the trace as well as the trace. All the information that I just entered in real time. So with Miss Patricia Hodges here, the one that I showed you, the time-lapse view, what happens here is you can start comparing things side to side, looking at things, looking at Braden's, looking at total skin assessments. You can drill down into the wounds. You have all the graphs of what's going on with this patient in the top right, easy for you to look at. You also have a side-by-side comparison. So if I'm out in the field and I need assistance, Lily can actually look side by side of what's going on with Miss Patricia and actually help me and give me guidance if needed of what's going on. All this can be exported to PDF as well as it can be looked at in a table view. So if you're looking at the physicians looking at information or wanting to see the history, we can go from there. So again, if I look here, I can see the information. I can see the measurements here, the characteristics, the treatment, the push score, the pressure ulcer score for healing. So the push score essentially is telling you a different way to look at it. With the graph of here, you want the push score to decline because that's indicative of the wound healing. Another thing that Miss Lily may be looking at is driving compliance. I want to know what's in progress, what's been done, what's been completed. So this is a way that Lily can be looking at in the back office of what's going on. How can she drive compliance? How can she see that Amy's not signing and locking her evaluations, or Siobhan as well? We can look at the signed, we can look at completed, we can pull up specific patients. So we can see everything here that's been completed on Miss Patricia Hodges as well. Holistically, we can look at the wounds from a holistic level. So essentially in real time, I know exactly what is going on my entire census. So I know exactly I have 43 new injuries, and anything with a little red house is indicative that this was, that they acquired this while on my census. So if I'm the wound care specialist in my agency, I know exactly I need to be focusing on these new deteriorating installed wounds. Improving and monitoring, I'm not so worried about, because those are going in the right direction that's going on. I can look at my historical data. I can look at multiple locations. So if my agency has multiple locations or multiple offices, or if you're broken into teams or zones, you can actually identify what's going on in that zone or that region. Risk. Again, we know that with OASIS D that the risk has been removed, the question, but that doesn't mean we still shouldn't be identifying risk. So we can look at our risk for our patients here and make appropriate updates to their plan of care, right? Who is at high risk, who's medium, and who's low risk, right? Because we want to say, should we be reaching out to the physician? Is there a dietary? Do we need to have education with the family regarding what they're feeding them, or turning and repositioning, right? We don't want to acquire those in-house wounds. So how can we manage the patient's risk? As well as here in this surveillance, looking at things holistically from a QA perspective. So if I'm looking at a QA, I can here very easily look at the last 90 days. I have a graph if I'm more of a visual person, or if I'm more of a data person, I have a chart view. So if I want to start looking at all my pressure, and I want to look at specifically one location, I can start drilling down into things that may or may not hit my quality measures. I can identify issues for concern. If I'm having all of a sudden my existing in-house acquired getting worse, why are they getting worse? Is it related to a specific nurse, a specific family? Is this patient's maybe need to be on hospice? Existing in-house acquired that are getting improving. I can also start drilling down farther from here. I can manipulate this to, if I want to look at stages, do I want to look at surface area? Do I want to look at treatments or dressings or progress from here? From this perspective as well. The ability to manage your own user roles and your patients, right? Admitting those patients if you don't have an integration. I can manage my staffing. I can assign specific roles from there, as well as if I choose to use PDFs, I can export those in batches as well. So with that being said, I'm going to switch back over to the deck here. And so I've gone through this Swift Helix. Again, it's the blue dot or sticker, as people call it. It's the calibrant for lighting, consistency, and size. The Swift mobile application that is available on iOS and Android phone or tablet. Again, available on and offline. And then the web dashboards that's accessible from any web browser. So in real time, those remote reviewers can help. Your back office can manage and look at quality analysis from there. So with that, I'm going to hand it over to Lily, who's going to do a little overview of REACH.
Good afternoon. I'm glad y'all could join us today. So we are currently using the Swift app. We have been in home health for 32 years. Terry, Gerke, and Bonnie are our managing RNs. We currently cover Houston and all the surrounding areas. So for those of you who live by, you know how large that area can be at times. We also, if you'll move on to the next slide, please. We are a licensed and certified home health care agency. We have been taking care of patients in their homes since 1987. We do see a complex of different diagnoses here within our census base. It can be anything from catastrophic injuries with multiple comorbidities, progressing diagnoses such as MS, ALS, things of that sort. Like I said before, we do cover Harris County and all the surrounding areas here in the Houston area. We are owned and operated by 2 registered nurses, and of course our managing and directorial staff are also RNs. Nursing care was offered by REACH. It's a central feature of what we do, although we do have other lines of business as well.
Great, thank you, Lily. So with that, we're going to flip over to a Q&A session between Swift and Reach Health Services. Again, if you have questions, please submit them in the question box. And we will answer them at the end, or if as they're coming in, if they're pertinent to the topic, we'll just keep adding them right in. So with that being said, Lily, PDGM is a hot topic right now in the home health space. What are you doing to be prepared? Is there any fundamental changes that you can share with our audience today on PDGM in general?
I think the main thing that we're doing here is we are concentrating on the treatment that we give with our patients that's appropriate to their diagnosis and very appropriate to the discipline that they need. To us, it is not necessarily a new concept, because for years we always try to use proper utilization of the services that are needed in the home. With PDGM, of course, this is the main thing that we need to do. Our admitting staff has all received appropriate OASIS training so they can choose the answers that best represent the patient's status, which then reverts to the care that we can provide. If therapy is indicated, we work with our therapists, coordinate that care to ensure that we're all on the same page and we're doing what's best for that patient. Given our current expertise and the type of patients that we see, we do foresee being within the ranges that we need to be successful, as our patients are a higher acuity type of patient than what you typically see in a home health setting.
Great. With that, in the past, what challenges have you seen in the industry facing in trying to deliver wound care management in general before PDGM?
In general, with wound care, some of the things I think a lot of agencies will see across the board is that you do have an inconsistency of your wound measurements, which varies from clinician to clinician. You also, documentation, I think, is a struggle that we all have within home health to get that information to the individuals who can read it and pass it on and make changes to the plan of care. We see that a lot. So there isn't, although we try to be standardized, it's very hard to do that when you don't have something specific in place to do it. And then in wound care, one of the most important things is to be able to capture those images that actually tell the story of the wound as it progresses, as it heals, and of course sometimes as it deteriorates. So those were pretty much, I think, across the board wound care challenges that we would face on a day-to-day basis.
Great. So in the past, before Swift, do you have any recommendations of how you overcame some of those challenges?
Truly, it was all a manual process, in the sense that our case managers actually had to go into each individual chart, look up each picture for each week, and then compare also those sizes and try to determine whether the size changes was truly wound based, or if it was perhaps one nurse measured one way and another nurse measured the other. So it was all manual spreadsheets, type things that would tell you this one got bigger, this one got smaller, type things. So it really, really relied on a manual process. And we all know that there's always some things that just don't go the way they need to when you're doing something manually.
Great. So you were already managing wounds in a successful way, but more in a very manual oversight prior to using Swift.
Correct.
Okay, great. So what has prompted you to seek out Swift as an improvement to your wound care program?
I think the thing that stood out to us the most was the fact that it is a real-time application. We can see what's going on with the patient on a day-to-day basis instead of a weekly basis. And amongst that too was the fact that we could get a consistent image and a consistent measurement within it, since the application guides you on how to do that. So that was really, really helpful. Regardless if you have 2 patients or 150 patients that have wounds on them, the ability to be able to actually see that wound live just makes a world of a difference for the patient. And then the fact that we could use it on a cell phone, that they don't have to carry an extra laptop, an extra gadget or something with them. It's as simple as downloaded an application. That was also something that was very appealing to us for our clinical staff.
Great. So with your clinical staff, obviously technology is a change in adoption, right? Anytime we get a new phone, it's, we want to play with it. We want to do that technology, it takes a day or two or a couple days to use your new phone. So how has your response been among your field staff to using Swift's technology?
It's a change. So we all know how we take change at first. So we did have that initial pushback questions of what is this for? What's it going to do for my patients? You know, things of that sort. But overall, it was well received when we started showing them the dashboards, when we started showing them the comparisons, the side to side. You know, this is how your wound looked last week. This is how it looks this week. When they started to see the clinical benefits of the application, they were much more open to it. They really did enjoy the fact that it was on their phone, and that these pictures didn't get saved to their personal gallery. It was actually saved up on the cloud. So they didn't have to worry about going through pictures and then, you know, getting a hideous wound when you're showing pictures of your puppy or something like that. So that was also something that they really enjoyed, not having to have that on their phones.
Great. Yeah, just to elaborate a little bit, that you talked about not showing in your gallery, Swift is fully HIPAA compliant, right? It's not going to save anything to your phone. If you lose your phone or it gets lost, you have to have a secure login to log into it, as well as it meets all the HIPAA and SOC compliance as well. So that shouldn't be a worry. Like Lily's saying, right? It's not going to get into the wrong hands of any of your field staff. So with that being said, what other results have you seen so far with Swift's technology? Just in general, right? Like we know it drives wound care, but is there any other adoptions or any other benefits that you've seen by using Swift's technology?
Truly, what's been good for us is that dashboard. The fact that we can actually have a list of wounds that have stalled or that are deteriorating, that is vital in a wound care program. Before, when we relied on our spreadsheets, there wasn't a flag or anything that let you know, hey, you need to look at this. The dashboards offer us that opportunity every single time that we log into it. We can have a patient seen in the morning, and if we log in the afternoon, it'll let us know that, hey, something's going on with this wound. So that in itself is something that we rely on a lot with using this program.
Great. So what has been the most challenging about implementing a new wound care process in general?
Well, the fact that it's new, like I said, that's always a challenge everywhere that you go. I think right now the thing that we're still working on improving and becoming more efficient on is the actual picture taking process. Like we're all used to taking pictures a certain way. To be successful with the program, you do have to poise your camera in a certain way to get the best picture. You know, so getting them to learn that is something that we're struggling with some clinicians, while we don't struggle with others. But then at the same token, those images, the way they come across is just really beneficial to the clinicians, because they can see the previous one while they're doing their current picture. So it automatically lets them know, you know, what's going with that picture. Another change that our clinicians have to adjust to is they have to get away from the traditional measurement, so to speak. We get so accustomed to seeing length, width, and depth that we never actually took the extra step to get the surface area of the wound. So now we get that surface area, which is really what we're looking at. We want that to decrease. So getting them into that mindset of, okay, you know, it's not exact if you go in and measure it by hand, but look at the surface area of your wound. It's actually improving. You know, just getting them to switch into that mindset is something that we work on a day-to-day basis.
Great. So what does the future of wound care look like at Reach?
We are hopeful that we'll be successful in having a next level coordination of care for our physicians and for their patients. What we mean by that is that we have a live system. So I can see what's going on with your wound on a day-to-day basis. So instead of calling a physician with generalities, I can actually offer you a PDF with comparison pictures of the wound, measurements, what it's doing, all on one page. So it takes all the guesswork out of it, so to speak. And then we could do that every time we see something that's stalled or it's deteriorated. We can actually have a more efficient conversation with data to back up what it is that we're telling our physicians.
Great. So with that being said, I've been paying attention to some of the questions that are coming in as Lily and I are speaking. So we're going to switch over to some of the questions that the audience had. But before that, Lily, is there anything else that you'd like to add that we haven't covered yet?
No, I don't think so. Just for those who are considering using the app, it is something that is very beneficial to your patient. We have the ability now to actually see the wounds, like I said, on a real-time basis. And for all of us who know wounds, I mean, wounds can change from one day to another, you know, so this actually helps you stay ahead of the game with that wound healing.
Great. Great. I think Rosin's going to moderate some of our questions, and then Lily and I can answer and give some responses and feedback.
Great. Thank you, Amy. So the first question, Amy, some of the audience is asking for a refresher on what the PUSH score is.
So the PUSH score is the pressure ulcer score for healing. So the PUSH score has been around for many, many years. And in some contexts is used as the standard for measuring healing for pressure ulcers. So it is calculated by the length and width, the surface area, as well as exudate type and amount. So based on those, it's a grid, it gives you an answer and gives you a score. So every time that you do a comprehensive evaluation or assessment of a wound, you calculate the score. So ideally you want the score to be 0, and that would be a fresh healed wound or completely epithelialized wound. So it gives you a way to identify, is your wound stalling in the progression? Is it healing quickly? Is it deteriorating? So it's just another mechanism besides looking at surface area to indicate if a wound is healing. We all know sometimes when wounds are debrided, your surface area increases, however, your drainage type and amount decrease. So just because something is increasing in size doesn't necessarily mean that it is getting worse or deteriorating. So a PUSH score gives you another way to look at that. We also can calculate a BWAT score as well if you choose to use a BWAT. I just happen to show a PUSH score in this demonstration.
Great, thank you. Lily, we're thinking about a lot of different investments about PDGM. Since you guys were already doing wound care well, why was this one prioritized for you?
Wound care has always been something that can be improved upon. Like I said, we were doing a manual process, which does take a lot of manual hours. When you're looking at trying to be more efficient and more resourceful with your finances, this was something that we felt was beneficial both clinically and operationally.
Great, thank you. This one could be for both of you. How does Swift help with proper coding and documentation?
The app itself won't spit out a code that I'm aware of, but it does allow you to identify that wound, the staging of it more appropriately, if it's not something that the physician has already told you. The images that they provide are very sharp, and they're very beneficial, especially when it comes to the staging part of a pressure ulcer. You kind of feel like you're in there with the patient looking at the wound when you look at the images when they're captured appropriately.
Yeah, and just to add to that, you know, we had that remote reviewer access, right? So if a clinician's out in the field and has a question, they could call me as their wound specialist for their agency and look at this in real time, right? As well as I can be looking at these things on a day-to-day basis, and I may see something and reclassify it as the expert because maybe that nurse in the field hasn't had wound care training in the long time. There also is best practice guides. So essentially the clinician can swipe to the right while they're in the application, and it gives the MPUAP guidelines for staging criteria. So if they're out in the field, they have a question, they're not quite sure, they can just swipe when they're in the app and it'll give them the detailed description with the pictures of what recommended staging guidelines are.
Great, thank you. Amy, some questions around privacy and security. You touched on this already, but can you review Swift HIPAA compliance? And also, can it be used on bring your own device?
Yeah, great. Yes, so Swift skin and wound application is fully HIPAA compliant, SOC compliant as well. So it can be used in multiple ways, right? It can be used online and offline. And irregardless if it's used online or offline, it's still going to be compliant. And what I mean by that is it's encrypted in flight and on the device. So like Lily had touched on, if she's showing a friend a picture of a dog or a child, and she's not going to accidentally show a picture of a wound in her camera roll. Nothing gets saved on the device itself. So nothing gets saved on your camera roll or anything along those lines. It gets saved within the application. So for example, my 5-year-old can't come grab my phone and just touch on the application and log in and see all the pictures, right? They would have to use a secure login to log into the application to see the images. So with that, we do see a lot of agencies bringing their own or allowing their staff to bring their own device. Again, it works in Android and iOS. So you're not forcing a Android person to learn iOS or an iOS person vice versa to learn Android. So it gives that the freedom, the flexibility. It lowers the cost to the agency because you're not purchasing external hardware, external devices, or anything along those lines. Like Lily said, it's already something that every nurse has, or pretty much every person in the world, or in the US has right now, is some sort of smartphone device. I say if anyone can use an iPad or can use a phone to take a picture or surf Amazon, they're going to be able to use this type of software to take images, use this in the home health setting or any setting in that aspect. Because we know we have some seasoned nurses out there, and sometimes technology is scary. So if they're used to their own device that they use at home, it gives them that freedom. Your agency is protected. There's no HIPAA concerns, and they're comfortable using that type of device.
Great. Lily, how did you go through the process of getting Swift brought into your agency? What convinced your owner?
I'm sorry, could you repeat that one more time?
How did you go through the process of getting Swift brought into your agency, and what convinced your owner?
So the way we got Swift brought into the agency was Terry actually spoke to a representative of Swift with all the questions that she had regarding the application, similar to the questions that are being asked now, how it would work with our EMR, if it was HIPAA compliant, ease of use for our clinicians, successes that they had already had with the apps. So what prompted us to move forward was truly that huge change coming in January with PDGM. And then also it offered us the ability to look at our wounds on a live basis, so to speak, which in turn allows us to be able to, like I previously said, to give that appropriate report to our physicians that are handling the wounds. That in itself was just really the deciding factor, was how it was going to impact our patients. That to us truly is the main course why we'll change anything operationally. The plus side was that it just did assist with all the other changes that are coming.
Thank you. Another question for you, Lily. How is your marketing team using Swift to communicate with your referral sources?
So what we're currently doing as far as our referral sources go is we are letting them know, hey, we have this new app. This is how it works. We do have some of our training patients in there, so we can show them like the progression of a wound, kind of like how it was shown here on the webinar. Our goal will be, if we have a physician that they're out speaking with, if they want to see one of their patient's wounds, our marketing team has access to the app, so they can go in, pull up the specific patient and show them there the comparison, the side-by-sides pictures, so the physicians can take a look at them and see how the wound is healing or deteriorating, if that happens to be the case.
Great, thank you, Lily. Amy, this question is for you. How was the software proven to be accurate?
So we are the only clinically validated digital wound care management software out there. So we have multiple published studies regarding the accuracy of the measurements, the accuracy and the consistency of the measurements, as well as interrelator reliability studies, meaning manual measurements versus first-time users using the application, getting consistent calibrated images with measurement. So we are clinically validated in the accuracy of our measurements.
Great, thank you, Amy. Getting some questions about how Swift is priced. Can you speak about that, or to that, sorry?
Yeah, I can. So Swift is a yearly license fee. It is not a per user license. It is based on your agency size. So a Swift representative can give you a more detailed description on that, but it's not, if you have 5 nurses versus 500 users or nurses, you're not going to pay per user. You're going to pay based on your agency.
Great, thank you. This is for both. How can the physician see the wound information?
Well, like I said, what we're currently doing, that would be us sending them a PDF of their patient with the specific wound and how it's healing, which would be the pictures, the graphs. We can email that to them so they actually have the clear pictures. It can be a one-on-one, like I said, if our sales team happens to be there with a physician, they do have the capacity to log into the app and pull up that one specific patient and show him straight from the app how he's doing. Our ultimate goal is that we're sending reports on a weekly basis to an email address, like I said, so they can actually see the pictures and they can have, you know, that weekly report of how the patient's doing in the home.
Great. And I'll just add to that. In other agencies, we've seen some of them actually give access to those physicians as well. So with Swift Skin and Wound, you actually have the ability to obviously manage your own users, but you can grant their level of access. So like Lily's saying, they can grant marketing the access, and marketing can view only. So when marketing's out there, you don't have to worry about them accidentally touching a button or tapping something on the mobile device and changing anything. So they can give them access just to view or read only. So that ability can be granted for physicians as well. So they can log in on a mobile, whether it's an iPad or a phone or a tablet. They can log into the web as well. Like Lily said, you can do the PDF, so you can email that PDF securely to the physician. You can also, we have the export feature, so you can do an export to that physician as well using a secured messaging system if needed as well.
This one's for Lily. Lily, do you utilize LPNs for dressing changes?
Yes, we do. We use both RNs and LVNs for our wound care program.
Amy, do you see that a lot?
Yeah, so what we actually see, and I don't know if Lily's utilizing this at all or not, but essentially what we see is a lot of our agencies are actually changing their staffing models a little bit related to wound care. You know, an LPN can evaluate and collaborate in combination with an RN or a physician. So by using this tool, it gives that LPN or LVN the ability to evaluate a wound and collaborate with an RN or a physician. So what we see a lot of times is sometimes the agencies are having RNs go out for that start of care visit, sending LPNs or LVNs for dressing change visits because maybe we don't need a high, you know, a skilled RN set to go do a dressing change. And then if there's changes identified with a wound or a deterioration, maybe myself, the wound care specialist, would switch out and go for a visit, right? So we're actually seeing a lot of our agencies drive some of their staffing compliance and optimizing their staffing on a financial level, because now they have that entire visibility into their wound care census. So you're not sending someone out for unintentional windshield time, right? Where that wound care specialist is going out to see a patient because the nurse called and said over the phone that this is the worst wound and this terrible description, where now they have a consistent description regardless of the nurse, as well as an image to back up what they're seeing. So we're seeing it again in multiple different agencies. Some of them are actually changing staffing models in wound care related to using the application itself.
Amy, is Swift just used in home health?
No, Swift is used across all the continuum. So we have our core that we started was in skilled nursing. So we're in thousands of skilled facilities across the US. We also operate in home health, as well as we are used in wound care clinics, inpatient and outpatient wound care clinics, as well as hospital settings. So we are a truly cross continuum setting.
Great, thank you. Is there any training provided on the software?
I'm sorry, can you say that again?
Is there any training provided on the software?
Yeah. So our entire enablement team and your trainers would be nurses, right? We want to ensure that when we train you on the software, that we understand your workflow. You know, we always talk about we're not here to change your policies and procedures. We're here to augment and streamline them. So in order to train your staff clinically, we need to understand your clinical basis. So we go through a crosswalk, we go through discoveries, and then we go through comprehensive super user training. And then even after you go live, we're still going to follow you. We're not just going to say, here, use the software, turn it on, and we're done, right? We want you to succeed. We want you to be successful because we want those patients to have the best wound care experience possible. So we will follow you post go live, ensuring that you're using the application properly, consistently, as well as if you have questions, feedback, any suggestions for improvement. You know, we're always working to improve this great software. So we will set you up for success and follow you throughout the duration.
Thank you. This one's for the audience. Last call for questions. We may not be able to get to everyone, but send them through and we'll follow up after if we don't get to yours. So another question for Amy, where do we get the Helix stickers?
So the Helix stickers, you can order them on the website once you purchase the solution. They are FDA registered calibrant, so they are a medical device. So once you purchase the Swift Skin and Wound program, you would have the option to purchase the Helix through the website or with your contract.
Great, thank you. Amy, does the software recommend treatment options today?
So currently today, it does not recommend treatment options. You know, we are an AI and deep machine learning company. So where the future will take us, you know, we're always evolving and always growing. We can consume your best practice guides. So again, if you use a specific formulary or a specific best practice guides to your agency, what we can do is we can populate those in the application. So just like when I talked about swiping to the left, you would see those inline best practice guides for what your agency uses or utilizes for formulary, as well as the staging guidelines.
Great, thank you. Lily, REACH has been a leader in wound care in your area and continues to be. Any recommendations to other agencies wanting to build their wound care program?
Standardization, I think, is key. I think there isn't a home health agency out there who doesn't have some kind of wound care program. But I think what's key to it is that we have to have everybody on the same page. Everything needs to be measured the same way. We need to follow the protocols that we have in place. I think Swift offers you that opportunity because you're able to see and correct the images as they come in. I just feel that in order to be successful for our patients' care, we just need to be consistent in the care that we provide, and Swift makes that easier to do.
Great. Thank you so much, Lily. We had a lot of questions, so sorry to anyone we can get to. We will follow up. Thank you for everyone for watching, and thanks again to Lily and Amy for this webinar. And I hope everyone has a nice day.
Great. Thank you. And just a follow up, if you have questions on Swift Medical, you can go to our website, swiftmedical.com. You can book a demo from there, as well as a recording of this will be sent out to all attendees by the end of the week.
Y'all have a good afternoon.
Great. Thank you.